Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health. Yep.
Well, welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our co-host.
I'm Anna Kate, your medical mystery overachiever and discovery liaison, and we are back with one of my favorite topics on this episode of our mini-sode series, infrared therapy.
Yes.
I use mine in several different ways every single day.
Which is amazing. Tell me about those.
Every day. So I have a we just talked about PMF.
We just talked about PMF. If you haven't listened, go back because that's also an awesome modality. But
infrared therapy, I have an infrared mat that has their amethyst or jade stones.
Yep. So is it a biomat?
It is not a biomat.
But similar?
It's very similar.
Cool. I have a biomat.
At the time when I got it, that was a little out of my price range at the moment.
Yeah.
So
I got it for a great deal.
Yeah, I bet you did.
They're very expensive.
But I got one it was still expensive. It wasn't quite as expensive as the biomat at the time. But if you can get a biomat, go for that. It's much higher quality than mine. Mine's kind of falling apart. It still works really well. But
as long as you feel the benefits.
Yeah, I use it so much that the outside, whatever it's made of, is coming apart. And it's now like back to fabric. But it's all good. Anyway, I use that. And then I also use my infrared sauna. I have a sauna. You have a full big sauna with lights and all kinds of stuff in yours. Hers is really cool. But mine is just the infrared heat in a chair in a tent.
In a tent. So yes, there are, first of all, infrared. Let's break it down. What is infrared? Infrared is very different. I like to establish a difference between infrared and like a normal sauna, if we're sticking with saunas for a second.
Okay.
Normal saunas are moisture, right? So the moisture, like those moisture saunas, they heat you up, but you're sweating. Kind of what I feel like happens personally is like I'm sweating from the outside.
Yeah, they heat the outside air up and then your body gets warm from that.
Exactly. Versus infrared, those wavelengths are penetrating your cells at such a deeper level that your skin doesn't get hot to touch first like it does in a normal sauna,
right.
But you're heating, those cells are being penetrated and you're heating up from the inside out.
And it's a dry heat. It's not a wet heat.
It's a dry heat, exactly. But you'll find, or actually I find that I sweat faster once I'm detoxing better.
Right.
In infrared versus a moisture sauna. So it's just very different. Like saunas are great for multiple reasons. If I'm talking to a patient who needs true detoxing, I always prefer an infrared over a normal sauna. Although sweating is sweating and sweating is great, it's very different. One is much more kind of topical, I would say, like water weight just coming off. And the other one is down at a cellular level.
You have to say it like the Swedes do. Sauna.
It's a sauna. It's a sauna.
Okay. She and I like our infrared saunas. I'm not about to get in the back of in a regular Swedish sauna. I
feel like I'm suffocating.
Yeah. With all that hot air and wood and all that. That's not our jam. We like it kind of nice and clean and easy.
Yeah.
So do you also find that when you use your infrared sauna more consistently, that even in the summertime when you go to work out or go sit out on the beach,
100%.
You sweat more? She and I are such bad detoxers. We don't get sweat.
Yeah. If you don't sweat easily, you're blocked up. But it is true. If you use an infrared sauna more frequently, then you'll find that you're sweating more easily. And some women
in the outside world.
Yeah. Some women are like, I don't want to sweat. I don't like that. Like, why am I sweating more easily? And I'm like, dude, it's because you're detoxing better. Like, this is a good thing. That is one of the 3 ways our body can eliminate inflammation: pee, poop, and sweat.
Mm-hmm.
So it's a wonderful thing that you're sweating more. It's not a good thing that you can go work out in 95-degree weather outside and not
And
have
you're
a
not
bead of
sweating. Yeah.
sweat. Yes. So the other thing that Anna Kate mentioned is there's different types. I personally have in the office, we have a sunlight and sauna. And then my mom has one as well. So we, just hop on over in hers and to use it. So we have that, but there are tents, there are different modalities and different companies out there. I like Sunlighten mainly because it is EMF protected.
Mm-hmm.
It's also made out of natural, safe wood and not synthetic, gross, chemically filled
Right.
like sealants and glues and things like that. Because the most counterintuitive thing you can do is put yourself in this awesome infrared sauna where you're detoxing and you're sitting on glue.
PVC that's off gassing.
Exactly. So they have awesome just resources and materials and protection. So you're also not just infiltrating your system with EMFs. I'm also crazy, as you guys know,
Yeah.
but that's why I choose their company. The tent is wonderful because it can also be on the go. You
Right.
can bring it with you places. The one thing,
It's convenient. It's not quite that convenient.
it's convenient, but how do you feel? So the one thing that deterred me was the head. Like, you don't mind that your head's not in it?
No.
Okay. You like that?
So, well, it keeps me, I feel
Because
that
you're more jointy.
yes.
Yeah.
Yeah. So, if I do want to get my head in it, then I will go and do like a steam room
Okay.
and flush all of that out. And I have
Yeah.
access to that. So that's fine. It improves my circulation so much that I don't feel like I'm missing out
Got
not
it.
having my head
So
in
that's
it.
great to know because I come from always being in a full sauna. So to me, that is like, well, my head's chopped off.
Yeah.
So that's good to know.
No, your circulatory system
Doesn't just chop it at your head.
You're not done right here. The other thing is that there's also a sauna blanket that you can get it. It looks like a sleeping bag. So that one is a little bit easier to travel with because the heating element, the infrared element is smaller.
Yep.
So, and it's at the foot of your sleeping bag thing. And then it heats you up that way. So that's an option if you do have to travel a lot, but the tent is not.
It's not that on the go.
No. I mean, it's like if you're going to go somewhere for
like a while,
like a month or something, it would be fine because it's kind of small and compact. It fits in kind of the size of a big couch cushion. It's about that big. I mean, you're sitting in a chair and like my knees hit it.
Yeah.
So it is convenient in that way, but there are more portable options.
There are. And Sunlighten even has, it looks like, it reminds me of a small little MRI machine because you lay down in it and it's like a little tube. And so it's not collapsible, but you just lay in it instead of being a huge, big bulky sauna in the corner of your house somewhere. But anyways, with all that said, biggest difference between a normal sauna and infrared is that infrared, those wavelengths truly penetrate your cells at a deeper level, which means the benefits of infrared sauna are different, far different than your typical steam sauna. So let's talk about some of those. Pain relief and muscle relaxation. Because it penetrates those cells so deeply, it provides a lot of people pain relief and muscle tension relief. As you said, also circulation. It enhances blood flow and vasodilation and overall just circulation. And that means more oxygenation throughout the body, which is, slightly important to life.
When I get cold and I can't, my circulation is inhibited, I will go get in my sauna, even for 15 minutes before I go to bed. And it just gets me warm enough that it's also great when if you're getting those cold and flu chills.
Oh, 100%.
Go sit in there. It totally, because you kind of, I'm saying this not as a practitioner or anybody that knows anything and has any certifications, but when you have a fever, when you heat up your body can kill those organisms much easier than if your body temperature is lower.
Also just prophylactically, because I will say, like, when back, 10 years ago when I was working as a medical scribe in the ER, I was in a pediatric ER and you're around all the things all the time. And one of my friends was working at the time was working at like this med spa that had an infrared sauna. And I went once a week, maybe just once a week, maybe twice a week, but I think most often just once a week. Did not get sick. Avoided all those germs, all that inundation of just yuckies. So just prophylactically for your immune system also during this crazy whatever season we're in is wonderful.
It's year-round therapy.
It's year round, right? Wound healing, it's awesome.
Mm-hmm.
It can accelerate the rate at which our cells regenerate. So tissue repair, it's really good for. So last episode we were talking kind of post-op. I would never tell someone to get an infrared sauna when they're very close to a surgery, but to help improve range of motion and that tissue
Mm-hmm.
repair kind of in the long run after you're cleared from your ortho, maybe that's 4 weeks later, 6 weeks later, can be a wonderful modality to bring in, reducing inflammation, as Anna Kate's kind of talked about with her own joints and her ear tissues too,
Yeah.
and just getting that circulation moving so you can be more comfortable.
It's a must-have in my life.
Yeah.
It's a must-have.
I believe it. It's huge also in kind of the anti-aging community with skin health and rejuvenation. And it's been proved to kind of provoke our production of collagen. And so that improves our skin elasticity. So if that's your goal in life,
Yep.
infrared sauna is going to nail that too.
Yep. So there is also an option. So especially if you have joint issues like I don't move very well sometimes. So like I can't go and do a traditional workout, but I can get in my sauna and I will shower first, go get in my sauna, get warm, do like 15 minutes and then stretch and then get back in for another 15, 20 minutes or so, get up a really good sweat and then go take another shower and rinse all that out that I've just detoxed and gotten out of my body. So it's like an additional workout because my cardiovascular is raising, and that's gets in an extra workout for me if I'm working out, like if I'm actually working out and cycling and doing all the things. But for me, I'm limited in my spoons for the day, and sometimes that's the only quote unquote workout that I get is moving my systems through that.
And there's such a huge component with infrared sauna in improving our cardiovascular system as well, like literally improving that endothelial function. And you'll notice that with a normal sauna, with a moisture sauna, you get out and you're super drenched, right? You're sweaty, but it stops right away. Like your skin dries right away. When you get out of an infrared sauna, you feel like your insides are still working, like your cells are still, I don't want to say burning, it's burning in a good way, like they're still working and heating up. And for at least 30, 45 minutes after you've been out of that sauna, like don't ever shower as soon as you get out of an infrared sauna because you'll get out of the shower and still be sweating. So like the impacts last even after you've been out of that sauna, unlike a traditional sauna where you just get out and dry up and that's it.
Yeah.
So that tells you a lot too.
So I don't typically get out of the sauna and straight into the shower. I do stretches and other things for another 10 or 15 minutes, but I don't leave it on my skin, especially when I've had a really good sweat, because I don't want to reabsorb that. So that's why I rinse off if that's my thing. So but yeah, it keeps you warm. That's why I do it before bed, because it gets me warm before I get into bed, and then my temperature can drop during the night.
Exactly. And the other thing, obviously, that's wonderful for is detoxing. So if I put patients in like a big old detox protocol, depending on the patient, if they can handle it, I always want some sort of physical modality on board to help the body pull out toxins. Infrared sauna is wonderful for that. And we just have to be careful. If you are overall healthy, you can get in an infrared sauna, get out, and be just fine. If you know that you've been exposed to all the things, we have all these mold, all this metal, all whatever is bioaccumulating in your body, then you want to be careful and always take your binding agents when you do an infrared sauna. Because when we get into that sauna and our body is actively detoxing, okay, we're sweating it out, we're getting it out. Then we get out of the sauna and our body is still actively detoxing for quite some time afterwards. But at some point, our body does stop sweating. And so we want to come around that sauna session and make sure we have a good binding agent on either end that helps to gobble up those toxins that are freely floating around. And so that you can excrete it later via your stool.
Right. So that's like activated charcoal?
Activated charcoal, bentonite clay, zeolite clay, apple pectin, combination of all the above.
Yeah.
Yep.
So, and when you're taking your binders, around infrared sauna, make sure you're not taking other medications that you're using to combat other stuff.
Or supplements. Yeah, it'll bind to those binding agents. You need to take at least an hour. I mean, preferably an hour away from food, supplements, medications for sure. 30 minutes minimum around food and other supplements, but at least an hour around medications.
I'm running out of times and
I know.
days.
It's like,
okay, take this when you first wake up, but don't take it with food. But take this one with food, and you have to take it in the morning, but not near this medication or supplement. And then you have to take your binding agent an hour before you get in the sauna. It's like waking up at 4 a.m. just to take.
She's fine. Everything's fine.
I'm all good.
Anyways, infrared sauna,
Yes.
wonderful for these winter months, for staying healthy, for supporting your immune support, for just general detoxification, for muscle recovery, circulation, skin health. I mean, you name it. It's such a wildly easy thing to implement into your routine once a week.
Yep. So there are 2 other modalities with infrared light. So the red light therapy.
Mhm.
So that's an infrared. There's near and far. So they do different things. Near doesn't go as, is it near that doesn't go as deep?
Mhm.
And then far goes deeper into your cells and heats you up from the inside out. And then there's also, if you've been to like chiropractors use this therapy a lot, it's laser. It's called laser therapy, and it's a warm red light, and then they can put it on where you have more joint issues. It's safe for pets to use.
Yes.
So you've seen there's different things out there that use the infrared light.
Which, to your point, just last little bit about the laser therapy and the exact laser, I can't remember the name of it, but good orthopedic offices or chiropractic offices have it. Another good story about my husband. Well, this was, I don't know, probably 8 years ago or something. And he was 4 weeks away from a fight. He's an MMA fighter. And I got called, his coaches, I never this might have been like 10 years ago, because the gym that he was at the time, I never stepped foot in. Like, it was one of the best gyms in the world, but like, you just felt out of place if you step foot in there. Like, you don't belong in there.
Yeah.
Only the fighters do. And I never ever heard from his coaches. And one of his coaches called me and was like, "You need to come pick up Will." And I was like, "What do you mean I need to come pick up Will?" And he's like, "He just tore his hamstring, I'm pretty sure." 4 weeks away from a fight. And I'm like, "Okay." So I like walk in with my head down and just like go right to Will. And we take him home and we get him to an ortho, and sure enough, he tore his hamstring. And they're like, "No, there's no way you're gonna fight in a month." And it was a title fight, a very important fight. He went to a chiropractor that we knew locally. They did laser therapy on him maybe 4 times a week, maybe 5 times a week for the next 3 weeks, and he fought.
Will just may be really good at healing, but also Will's body is his temple too.
Yes.
So he's putting in the nutrition and the water and doing all the other things as well when these things happen. So.
And it wasn't like they did more imaging and things like that. So it wasn't like, oh, we just got him to a point where he can fight and we're going to destroy his body. And then afterwards, he's going to be, he's going to be all damaged. He was healing that entire time and healed so much using the laser therapy that he was able to fight at 100% 4 weeks later after tearing his hamstring. So these are how powerful these modalities can be. And we just want you to know that they exist, that they're out there, how you can utilize them in different aspects of your life. For the last thing I'll say with infrared is for kids. A lot of people ask if kids can get in, and a lot of practitioner offices won't allow kids to get in. So this is not medical advice, but I do in ours, I do put our kids in it. They are used to it. You start very low and slow, 5-10 minutes. They are not going in at 130 degrees like an adult would. They're going in at 95 degrees starting off, building up to like 100, 110, and just a couple minutes at a time. Kids don't sweat as readily as we do. So that's why practitioners can't be like, yes, let's get a 8-year-old in here. Yeah. So you really have to know what you're doing. And so I trust myself, obviously. So for my kids, if they're showing any little sign, symptom of being sick, they are going in there. But please, before you do that, consult with a healthcare provider.
Yes, which is why a biomat is a much safer modality.
Yes. Doing that they could lay on that all day.
Yeah. So there are things that kids can do, but in the typical sauna that she and I use for all of our things, just know your kids and know what's best. But an infrared mat is
super safe. Can use it at any time. They could sleep on it.
Yeah.
So we hope that is helpful. Stay tuned for some more mini-sodes we have coming your way. And until next time. Let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together. The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.